This is the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
Thank you, listeners, for joining us tonight on Labor Day. We're talking with registered massage therapist Anders Lau, and we welcome your calls immediately or during the show on issues of chronic pain, things that you might have successfully had help from members of the massage therapy profession. So, Anders, there's some misconceptions about massage therapy. Your profession is regulated in 3 provinces, and it needs to be regulated in 5 before the dreaded HST or other taxes are dropped. So people are not familiar with the fact that health services, in fact, do have taxes applicable to them. And I think in the fullness of time, your profession, I know, is growing in the other provinces. So eventually, as 2 more provinces get regulated, then that HST requirement is dropped. So this, however, does sort of raise the question for some listeners who may not have been to a massage therapist. First of all, how many members in your profession that you are at the moment? Do you remember?
If I had to guess, the last number that I was quoted, at least when I took my exam, was I think 3,000 plus,
wow.
Maybe even closer to 7. But you know what? It's been a long 2 years, and I've dealt
Sure.
with so many patients and not nearly enough of my own colleagues. So
now, this, of course, we're finding that British Columbians have access to health providers of all kinds. Now, what are some of the sort of more common conditions that the patient will contact your clinic for that initial visit to make that first appointment? What are some of the characteristics of the pains and conditions and injuries that you're seeing?
the few things that I could describe as the big 3 is what I call them, at least in my brain, is tight shoulders, low back pain, and another one that's coming up more and more as we're approaching an information-based society is arm, forearm, and hand discomfort.
So pretty much routine functional problems that every human being gets, whether it's through an injury, a sedentary lifestyle, or if they're working, 6 days a week, 18 hours a day.
Not including personal hobbies, for example, such as the things that I do myself.
Now, so when a patient, now those are sort of the big 3 as you call them, so the arms, the shoulders, the back, but there's a component to your profession and the health services that you provide. What are some of the things that you're trying to teach and educate the public about their body? And I imagine there's, like all health disciplines, there's usually a broader picture that we want to represent to our patients other than the condition that they bring to us. And that's really important for the later prevention that we want them to practice.
One of the parts that I personally, when I talk and discuss healthcare approaches with my patients, one of the things that I am most focused and interested in about is making sure that whatever they do, be it activities that they enjoy, activities that they don't enjoy, things that they have to do, that whatever they're doing it in a way that is as advantageous as possible for their body. That is, if they have to go down and pick up a heavy bag or pick up their children, that they're doing it in a way that's the safest possible, that'll reduce and prevent these kind of issues from coming back again.
Human nature being what it is, when we're well and we're busy with our lives and everything, we're not really interested in education on healthcare, which is a huge tragedy. We don't do an adequate job of informing kids between K and 12 in the educational system. So as a result, as we're busy with our adult lives or any lives, we don't want a story. But equally, when the pain and dysfunction and injury is there, we don't want an education. We just want the solution. How do you look at bridging that gap with your patients to try to get their understanding of the importance to take control of their health care?
One of the important sort of ways that I've worked on bridging that divide is almost often doing a very sort of tangible cost breakdown. Do a breakdown of how much it'll cost in terms of time, money, and personal effort to get injured, get better, get injured, get better, get injured, get better. Rather than saying, get injured, figure out what's the problem, how to address it, how to prevent it from ever happening again, and going on with the rest of their lives. The way that I sort of phrase my end goal with my patients is that, and I mean this in the nicest way possible, is that I want them to never absolutely need to come see me again. In an ideal world.
That's a great goal. And it doesn't matter what practitioner for what profession you are. We're all trying to do that. Number one, it's the altruistic right thing to do. And number two, human nature being what it is, eventually forget that message. And, some succeed in keeping themselves well for 1 or 5 years, some well for 1 or 2 months. Now, with healthcare, there's always the issue of costs. And we've talked about the Canada Health Accord before, which my own personal prediction is that this is going to end up with user fees from the Atlantic to the Pacific in probably everywhere other than hospitals, and that may not be a sacred ground as the debate goes on. So we won't dwell on that on this show. But for the patients that are seeking health services, so when a patient, if I were to come to your office, what are the elements of how those services are going to be paid for? So I've phoned up, I'm coming to you, I've got some chronic pain. How do I pay for that?
The first and foremost thing that I encourage is to do your homework. If you're employed, talk to your local plan administrator, find out if you're covered through your insurance, through your spouse's insurance. Barring that, if you're in a low-income situation, there is the MSP coverage for those who make $40,000 or less. And I encourage my patients to definitely look at those avenues first and foremost. Second to that, making sure that the amount of time that they spend to see me is as most efficient as possible. There's unfortunately a lot of times where some patients don't always get the message or aren't, because of their busy lifestyle, they aren't able to get to the places they need to be so that they can do all the prerequisite work, like filling out paperwork and going to the washroom. And those are the kind of things that I'm able to make more flexible for my patients, so that way the most of the time that they're using is for treatment.
All right. So speaking of the treatment, when people usually make their first appointment to whatever practitioner it is, that's when our pain is the greatest. So I'm hurting, someone's driving me in to see you, I'm limping in, or I'm walking really carefully because everything hurts in my body, and you're going to treat me. Now, my understanding is you're going to have to work on my body, and in most cases, this is with a practitioner's hands. Unless you're getting an injection, someone's going to do something with their hands. So how do you address this concern I have if I'm walking into your clinic with pain? You're going to make me feel better, but I'm in pain. How are you going to deal with that?
The first part I approach is helping patients understand what the exact cause of the pain is, what the few stages that they'll go through, where the first portion of their pain is really that the entire body and the mind at the same time is in a heightened sense of awareness. The first element of massage therapy that I actually use is what some would consider to be the least scientific, but in my consideration, I consider it the most important, and that is getting the body and the mind to calm. And that is getting the body and all its receptors to be in as eased a state as possible. When we are able to start with that, then we have a much better chance of affecting the actual change, because the body isn't as resistant to all these sort of adjustments and treatments that we're going to apply to the different structures.
Now, the average period of time, I know in my practice, I still practice part-time, the nature of my care doesn't require a lot of time to provide it.
Mm-hmm.
Your profession, it's entirely different. It's literally that hands-on experience. So what's the average time that you're going to spend with patients, and will that change? For example, if I've had a car crash and you're helping me recover from that chronic pain, to something I did this Labor Day weekend. I was unpacking my car when I got home. I lifted something off the roof, and all of a sudden I've got pain. So how does that affect the treatment that you might give me and the time component?
Depending on the severity of the accident, for starters. If you're involved in a 5-car pileup on the highway, your road to recovery, as well as the speed at which we can handle your recovery, is dramatically different. Whereas if it's a one-day boo-boo, as I call it,
Yeah, right.
that from a bit of weekend activities, we're able to start quite a bit sooner and quite a bit more deeply than with those high impact accidents, because with those impacts, the change in the body is that much more drastic. And rather than pushing through and attempting to correct those issues right away, there is an element of time away from practitioners and time away from treatment that needs to be addressed before we can even get to those other bits.
Now, we've talked with a couple of other members of your profession in the past, and I was very, very interested in discussing with one of your colleagues the aspect of childbirth and some of the other things. And although the conditions you've mentioned involve shoulders, back, and whatever, I don't mean that whatever, just anatomical whatever parts of the body, but we don't really focus in on some of the lifestyle and some of the things that happen to us as humans. And childbirth is mechanically and physically and emotionally stressful.
Absolutely.
And so I found it really interesting that your profession has sort of a really body of knowledge around that.
It's definitely as we are registered massage therapists, we deal a lot in seeing people on a regular basis. Unlike For example, if you come in for a surgical procedure, you come in once the surgery is done, that's the end of the care.
That's right.
Whereas with registered massage therapists, we've got to handle the day in, day out. You're feeling better, you're feeling worse, and because of that, one of the things that I learned, and I suspect that many of my colleagues also do the same, is that we start to look at patterns, and we start to look at the way that they can affect our body, either through patterns that we perpetuate ourselves or that are perpetuated upon us.
You know, I like the way you characterize that, because this is something that in my career and dealing publicly and otherwise, people tend to think about healthcare as they walk through the door and they expect a cure, and they expect it on the first visit. And that sort of modeling, if you want to call it that way, is a little bit perpetuated by the sort of media awareness of the example you gave of surgery. So the public tends to be aware of fairly dramatic things. So if I have a visit for, say, a prescription, a medication, or a surgery, that's a one-off event. But the reality of healthcare, even if you have those things, even if you have surgery, even if you require a prescription, or you're seeing a massage therapist or a chiropractor or anything, health is an episode of recovery, meaning it doesn't happen in 24 hours. And in your profession, you're helping that patient over the time the body is taking to recover.
Absolutely.
And obviously the care is accelerating that recovery.
Absolutely. And even beyond the period of recovery to where they achieve their ideal health, an important part is just as much working on prevention and optimization, as I like to imagine it, just so that rather than simply maintaining a level of being healthy, but encouraging and possibly pushing patients to go beyond that state where they're not necessarily in pain, but they're more active and they're more capable of doing things than they previously used to.
Now, before computers came along, this is before your lifetime. I remember life before computers. There was typewriters, faxes, and real telephones, something
Absolutely.
that are pretty much in museums nowadays. But the technology and the whole impact of technology in our lives, whether it's our home, and in this case, particularly the workplace, technology is so consuming in terms of the brain interacting with that information, but it has the consequence at times of sitting there, and there's no such thing as I'm just going to be 10 minutes on the computer.
Not anymore.
It's more like 30 minutes to 2 hours before you realize, oh my God, I'm late. So this is having an impact called sedentary workplace, and that's causing an aggravation, if not causing new conditions, but at a minimum, it aggravates old conditions. How do you deal with prevention as a massage therapist when you're seeing this with patients?
One of the things that I've been working on is by harnessing the exact same problem that we have, which is technology. Technology has the advantage of constantly being aware of what happens. There's always status updates, logs. Most computers come with clocks, or cell phones have come with clocks.
Right.
So one of the things that I also do is encourage my patients, and eventually I like to do this as a long-term thing, set up automated systems where the technology is making those reminders for us, because it has that ability to constantly keep track. It's been 20 minutes. You should get up, go do something. It's been 30 minutes. Get up and go do something.
Well, I was developing sort of a long process of development. I was developing sort of a screen app that the user of that computer can set in terms of time. And let's say you set it for 45 minutes, up pops the screen app, and these animated graphics of an exercise and getting out of the chair and doing 30 seconds of exercises.
Sounds right up my alley.
So, as soon as I finish that app, Michelle's going to help me send it out over the iPhone and the iPad world. And, if you want to help us on that, Andrew, we'll happy to talk to you afterwards.
Sounds like a plan.
Now, Anders, in your practice career right now, one of the things we talked about prior to the show tonight was that you are seeing quite a demographic difference in the population around the Lower Mainland that you're treating. So I'm very interested to hear about that, because that's kind of an unusual thing, that you're able to see how there's a sort of a local community, meaning where people live in the Lower Mainland, and you're sensing that they have different attitudes about healthcare, and themselves. So I'll let you think about how you want to answer that so you don't upset anybody. Anyway, we're coming up to our break here. So this is the part where halfway through the show, we like to remind or nag, depending on what you need, the fact that as we do this next short break, that's just enough time for you to stand up, get out of the chair, and do those recommended stretching exercises. Because while strength and muscles are great, if they're not actually causing the spine, yes, you have a back, 24 bones to move, then the exercises aren't going to be as complete. So there you go. Off your chair, do the stretches. It's all about your health, You're listening to the Dr. Don Show live on AM 650.
The Dr. Don Show. It's your health, it's your life on the Astral Radio Network. There's still lots more ahead.